Hi, I'm Heather, and welcome to the Cerner Medical Student Training video for U of L Health. The topics we will cover during this video are patient lists, power chart toolbars, patient banner bar, provider view and in pages, dynamic documentation, which are notes, message center, physician handoff, results review, power chart, general menu bar, and orders as well. So just to get this class started, I have already logged into PowerChart as a medical student. PowerChart is the inpatient view and ambulatory view of Cerner. So this is one way. You may hear different names that Cerner is called, but PowerChart is what we're going to use today. So when I first open the chart, I am brought to patient list. The first time you log in, you will have to create new lists for your profile or activate proxied lists that have been shared to you. And then once those lists are activated, you won't have to do that again. So to start making your patient list, I'm going to go to this wrench right here called List Maintenance. You can see I have a list that's already been proxied to me, and we'll talk about that shortly. But for right now, we want to create a new list. So I'm going to go to New. I'm going to start by creating a location list, which is my second option there. Hit Next. And then I have to define the location of my list. So I'm going to use this top locations button and hit the plus sign. I'm going to scroll all the way down to University of Louisville Hospital today, hit the plus sign, and then I'm going to hit the plus sign again. Now, you don't ever want to put the little check mark to include all of University Hospital because that's a lot of patients, and it will freeze up the system. It'll cause it to kind of jam, so we don't want to do that. Today, we want to use two lists of patients where our patients commonly are. So we're going to choose 7 East and 7 South. Notice that as I add those locations, those nursing units, they're going to add to the name of my list down here, so I don't have to name it. Any of these areas that have the little nursing hat is an inpatient nursing unit. Another icon you might see here is the person in the wheelchair. That is an ambulatory unit. The 3 vials is a lab area. The mortar and pestle is pharmacy. And then another icon you'll see is a little face with a surgical mask, which indicates a surgical area. So we don't need to do anything else to this list. We're going to hit finish. And when you create a list, it comes over to your available list. So to pull it over to be a list you can see, we're going to highlight it, use the blue arrow in the middle to bring it over to your active list and click OK. Once we do that, we can see all of the patients that are in that location. You can scroll down. This is our test unit. So we've got a lot of patients on 7 East and 7 South. The nice thing about location lists is that they auto update based on that patient census. The bad thing about that, though, is that they auto update. So if you have some patients that you're needing to follow, you're probably best off creating a custom list. So that way, when a patient's discharged, for example, or moves to another unit, maybe they've been upgraded to ICU, and you can keep track of those patients. So as I said, we've seen that, 7 East and 7 South are 2 pretty big units. So we just want to see the 7 East patients. Anytime you need to update a list, you go up here to this second patient list icon called Properties, the little hand with the piece of paper. You'll click on Properties, and it brings up that location criteria that we saw earlier. There are other filters here that we aren't going to talk about in this video, but note that you can do relationship status of a criteria. You can do services, encounter types. Are they inpatient versus outpatient? Whether or not they've been discharged, just some examples. So we're going to go back to locations. We're going to hit the plus sign, find our ULH, University Hospital. And then here where we've put check marks in 7 East and 7 South, we're simply going to unclick 7 South. The name updated for us since we just kept it as the location names, and click OK. Now we maybe didn't see much change up at the top, but there is a much shorter patient list here that is only our 7 East patients. Another thing you can do to edit your patient list is this second to last icon here. But when we hover over it, this piece of paper with a pencil eraser is customized columns. This allows you to add additional columns to your list, such as nursing unit. You can select an item on the left-hand side. Once again, use the arrow in the middle to copy it over. And then you can actually use these arrows on the right-hand side to move it up or down the list. We'll use the Save button here. And then when we exit through the door, our settings to that list will be updated and we can now see that additional column of nurse unit on our list. So the second list type that we're going to create is a custom list. So as I said, these patients will auto-update based on the patient census. So perhaps we want a list that we want to follow patients for labs, or you only have a subset of a provider group that you're following. You might want to create a custom list for yourself. We're going to click New. Custom is the first option in our list type, so we're going to leave that highlighted, hit Next, and then all we're going to do on our custom list today is name it. So I'm going to say Heather's Patients for my name and hit Finish. Again, I'll choose from my available lists, move it to the right-hand column, and let's say I want that to be the first list I see when I open PowerChart. I can actually, again, use the arrows at the right to move it up to the top. So when I hit OK, I'm going to have two lists now displayed. One is that 7 East location list, and the other is my custom list. Now, there's no patients that auto-populate for your custom list because you have to manually add and remove patients. So if I knew from the 7 East list which were my patients, I could right-click on a patient and add it to my patient list. Or if it wasn't already on one of my other lists, I could manually add a patient. To manually add a patient, you find the little green man holding a sparkler because they're getting ready to be admitted to the hospital. We're going to click on that little green man with the sparkler, and we get to a patient search window. Today, we're going to use the patient MD ULH, first name Harper, and hit your search button. So you want to put in as much information as you can about your patient to bring up a limited number of patients. Because if all I put in for the last name, for example, I could have too low of a search. It also gives me a lot of information. But if I have their full name, perhaps date of birth, I can have a much more condensed search. The other thing to note is that up in the top is any patients that display within that search criteria. Once you've selected a patient up in your top box, you actually have all of the individual encounters. This is important to note that you need to make sure that you use the patient's current encounter. So encounters are identified by the FIN number, the financial identification number, and that is encounter specific. The patient will also have an MRN number or medical record number that stays with the patient forever. So for example, if you have a patient that comes in weekly for alcohol intoxication through the ED, they're going to have one MRN number for the first time they've ever visited, and they'll have 10, 15, 20, 100 different FINs, one for each time that they've entered the hospital. Luckily, my test patient here only has one FIN number, so I'm going to choose that correct encounter and click OK. So I've now added Harper to my patient list here. Notice that to remove the patients from this list, this custom list, they don't auto fall off unless you've set some sort of criteria such as remove when discharged. To manually remove a patient from your list, you would simply highlight them, and then you get this other green man icon with the red X, which will allow you to remove that patient. Another thing to notice about MRNs and FINs is that any patient that is a University of Louisville hospital patient is going to have an MRN and a FIN that begin with the letter T. So T we think of as teaching hospital. And then D, as in downtown, is for Jewish downtown. So the other thing we talked about with patient lists when we opened our wrench is that we had a list that was proxy to us. So I can see that it's a list proxy to me because in the parentheses after the list is the patient or the provider's name who proxied that list to me. So to proxy a list to someone, for example, this my custom patients, maybe I'm getting ready to add another med student to our rotation. I want to give them access to this list that I've been maintaining. I go up here to my list properties again, and this time I'm going to choose the second tab called proxy. When I hit new, all these boxes come available, and I can start to search for a provider to proxy this list to. So today we're just going to send it to our KY hospitalist. We want our attending to have this list that I've been working off of. And you can give patient list access, proxy access to any provider in the system with 3 different access levels. Full access is they can do anything to the list instead of delete it. That being said, when patient lists are deleted, they're deleted for any person that has that list. So if you get a list proxy to you from the stroke team, for example, if you decide to delete that list, you are deleting it for everyone on the stroke team. We don't want to do that. So what I typically tell people is to give them maintain access or read access. Maintain access will allow the proxied provider to add and subtract patients from the list so they can maintain it, but it will not allow them to be able to delete the list in its entirety. Read access will allow the proxied person to see the list, but they actually cannot edit any part of it. So I always like maintain access as long as it's appropriate for that provider to be updating the list. And then you want to give them an end date. So if there's someone that's going to be on this service indefinitely, you can march it out until years from now. Or if it's someone that's only moonlighting for a month, you can actually give them just a month's access to the list. Another thing I want you to notice in these date and time fields, if I were to actually hit the letter T for today, it's going to move it to today's date. If I go to a time field and I hit the letter N, as in Nancy, it's going to give me now for the time. So I'm going to apply that, and then I can see who this list is proxy to and hit OK. So for today's training, we already had a list proxy to us. We decided that that's a list we want to see, so we're going to highlight it from our available lists, move it over, hit OK, and now I have that additional proxied list. So when I go off of this service, if I don't want to see this list any longer, when I first entered the chart, I would simply go to my list maintenance and I would select it and move it over from my active to my available list. This way I'm not deleting the list for the entire service, but I am hiding it from my view. All right, so that's patient list in a nutshell. We talked about being able to add patients manually to your list through the green man holding the sparkler. There's also, though, if you're not wanting to add a patient to a list, but you're simply wanting to search their chart or search them in the system, we have on the right-hand side, we have a little search window with a magnifying glass. If you know the patient's name, you could quick enter it here, for example, and then hit the enter button on your keyboard and search. Or you can use the drop-down arrow to also search by MRN or FIN in this quick search box. Alternatively, you can hit the magnifying glass to bring up the patient search window that we talked about before. The difference here is that it wouldn't add them to your patient list. It would simply find the chart and allow you to enter it without adding that patient to a list. Some other items we're going to talk about up here in your Cerner toolbar before we get started, or before we go in directly into your patient's chart. So you might see here that we have, right now I only see 3 options, but anywhere you see the 2 little dots or sideways arrows with a down arrow, you can click that and it'll give you more options on your toolbar. So if you're looking at someone else's screen and you're not seeing exactly everything you think you should, simply hit that little down arrow, and you may have more options. Another way to make that a little more visible is any of these toolbars where you see the 3 dots lined up. If you hover over it, you'll get the 4-headed arrow, and you can actually click your mouse and drag those toolbars around. So you can drag it and make it a little more user-friendly for your experience. Speaking of experience, this My Experience button is really great if you're shifting between specialties. So it allows you to select a default organizer view or a default view when you come into PowerChart. Right now we're defaulted to the patient list, but you could default it to the organizer, which is useful if you're in an outpatient setting, to case selection if you're in surgery. You could have it default to the physician handoff page or the message center, depending on what you feel like you come to most often outside of the patient's chart. This in-page selection is what's useful so you can see what your attendings are seeing. So you can see that you're defaulted when we get into the chart to a general hospitalist view, but if you're on a women's health rotation, psychiatry, orthopedic, cardiology, or any of these other specialties, you may want to select a different viewpoint and be able to see what your attendings and residents are seeing. Case selection is the next option here. This allows you to see the surgery schedule for a particular location. Now, if you ever log in and you get this location selection screen and you don't see any items here, such as I don't right now, that means you don't have provider relationship established. If you get this window, what you need to do is give a call to our help desk and tell them that you can't see any locations in your case selection, and they will get your provider relationship settings fixed. So normally we would select a location, we would hit OK, today we'll hit cancel, and then it would show me the surgery cases for the day. So that's something a lot of our surgeons use. We'll talk about physician handoff and message center a little later on. The other item I want to show you here is this up to date. In the live environment, you can actually select that up to date and it'll take you out to up to date on the web, and you can sign up for that. As long as you sign up while you're on site at ULH, that account is free and good for 90 days as long as you log on to the network within 90 days. So that's something one of the first times you log in, you want to get your up-to-date set up. The last thing I'm going to talk about here is the calculator button. And then that's just a nice clinical calculator. It doesn't pull into the chart or anything, but if you wanted to quickly see the mics per kilogram per minute based on a different calculation, you could enter your values here and it will calculate for you. So that's a nice quick calculator. And then of course we have the exit button that we'll use at the end to cleanly exit out of the chart. The reason we want you to exit here versus just using the red X in the window is because this exit through the door is just a more clean way of closing Citrix out and making sure that some of your settings saved and your session completely closed. So we're going to go back to the patient list now and go into our patient's chart. So I'm going to double click on my patient to pull them up. I'm getting a duplicate name alert here because all of the patients in our test unit have the same last name. So anytime you have patients with the same last name on a particular nursing unit, you'll see the same duplicate name alert. Click OK to bypass it. The first thing I want you to notice here is this big blue banner bar at the top. In Cerner at ULH will allow you to have 4 patient charts open at a time. If you have multiple charts open, you'll see multiple tabs here across the top, and each of the 4 different charts will have a different banner bar color. The color doesn't mean anything other than to alert you as the provider when you're switching between charts. that, the first one is that you have open is blue, the second one is yellow, the next is green, and then purple. And it just helps catch your eye that, hey, maybe you've switched charts. So you'll see the patient's name. Their care team would be listed. This IS is any isolation status. The LVL is their level of care, such as med-surg, PCU, or ICU. You have some patient demographics. And then this location thing is one that we always like to point out to you. So you'll notice as I hover over certain items in this banner bar, they get bold and are underlined. And if I have an item that is bolded, I can click on it and it'll link me out to additional information. That location box links me out to any additional patient encounters that the patient has. So let's say you opened up this patient's chart and realized, oh shoot, I have their oncology encounter and not their inpatient cardiology or medicine encounter. I could click on that location button. So that's right here again. And I could choose a different encounter and then select OK to get me to the correct encounter without having to research for the patient. I also have their code status up here, who their attending is, and their allergies as well. The first thing you see below the patient's banner bar is this provider view. This is what you will automatically open up to, and where we talked about the M pages default view in the My Experience. Right now we're seeing a general hospitalist view, but if you wanted to see what cardiology, this provider view is what would change. The different tabs you have here, and then just how the information is organized a little bit. So what's nice in this provider view, it's somewhat customizable. So right now I have 5 tabs displayed. And if I'm not going to be doing much ambulatory stuff, I could actually grab that ambulatory tab and move it to the end, so that way it's not in the middle of all my other tabs. Or I could X out of it completely. If I needed to add a tab back that maybe I thought I wasn't going to use, and it turns out I am going to an ambulatory site for a little while, I can click the plus sign and simply select that view to add it back. In this first patient summary tab, it's organized into boxes called widgets. Each one of these widgets holds specific patient information or chart information. Some are defaulted closed while others are defaulted open. And all of that is stuff that you can decide how you want to view. Anywhere you see these 3 little lines with the down arrow called our hamburger button, it opens the section up a little more for some customization. So in this main hamburger button over on the far right-hand side of your screen, I'm going to click that, and I have several options here. One is my view layout, so I can determine whether I want 1, 2, or the default 3 columns. I like 3 because it allows me to see more information without having to keep scrolling. I have my drag and drop that if I click and see a check marks there, I can actually grab one of these widgets, as they're called, and move it around. See how I get the 4-headed arrow as I hover over it. So I'm going to move allergies maybe under vital signs. I want my labs over to the left, and I can just alter this. What's really nice about this is once you get it how you like it to look, it saves it for you, but just for you, but it saves it on every patient chart that you go into. Once you're done dragging and dropping, you want to make sure to go back to your little hamburger button and unclick drag and drop so you don't accidentally grab something and move it incidentally. You can also choose to expand all or collapse all. I think collapse all is nice when you are trying to customize your view. This components option shows you all of the available components for this page. Anything with a check mark is viewed on, and anything without a check mark is viewed off. So if you have items on this page that aren't useful to you, perhaps visits, you don't really care how many visits the patient's had, you can unselect a component and it'll come off your view, but you can always add it back. Another option you can do within the components or the widgets is this other hamburger button. You can choose whether or not you want it defaulted expanded, and you can also choose a color theme. So let's say in your current rotation that vital signs are really important to you and labs are really important to you. So you could color certain sections a brighter color to bring attention to them, to your eye. The other type of end page we have are workflow end pages. So workflow end pages are nice for going through, reviewing the patient's information on the chart, and being able to help build your note. So we're going to go through this inpatient workflow end page as if we are getting ready to write our H&P. We're going to enter a chief complaint of chest pain and hit sign. Care team, we don't have any. So let's say care team is actually a component that you don't typically find useful. You can, just as you can drag the widgets around on the summary page, you can drag these components around on the workflow page as well. To do that, you don't have to toggle it on and off. You just grab it or highlight it, click with your mouse, and then drag it up and down the line. The other thing you can actually do is hide a component again. So we'll go to our hamburger button on the right-hand side of this page. My only option here is this components, and I'm going to say that I want to uncheck care teams because I don't want it cluttering up my space. And I'm going to uncheck this readmission risk summary because that's not important for my role. It's only had 2 items come off my list, but it did shorten my list. So again, you can customize this for yourself and it'll stick for all the patients. So we had entered our chief complaint. We're going to go to our subjective history of present illness. And we're going to enter that the patient is complaining chest pain ongoing for 2 days. We're going to save that. Next, I have my review of systems. So here's a good place to show you that we do have some pre-canned phrases built into Cerner for our providers. And to get to those, we're going to type a period. So when I type period, I see that I have a lot of pre-canned phrases in here. And I'm looking for a review of systems. So I'm going to do .ros, and I want this .ros complete. So when I double click on ROS complete or highlight and hit enter, I get a complete review of systems that pulls into my patient's chart automatically. So because our patient is complaining of chest pain, we do want to edit this and say cardiovascular, they have chest pain, and maybe no complaints of the rest of these items. Okay. So we'll save this piece as our completed review of systems. Home medications we'll see displayed here, but you do not have to do home reconciliation. If you did, you would simply click on the word admission or discharge, and it would take you to the home med reconciliation page. Under documents, note that you can click on a document line and it'll open it to the right-hand side. If you click this view document button, it'll bring up a larger view of the document just so you can see it a little larger if you do have a very long note that you're reviewing. You can, in any one of these documents, actually tag data to pull into your note. So let's say that you, this physical exam, we wanted to bring part of it into our note. We could highlight it. And then when we release our mouse, we get this option to tag. So I'm going to tag that portion of the note just for training purposes today. I'm going to exit it. We can do the same thing on diagnostics. We open up this radiology report, and if I want to tag my findings, I can simply highlight it and hit tag. Now, if you were on site and this impression or this report had an image attached to it, you could click on this highlighted button here that looks like a projector. If it has some color to it, it means that there is an image attached to the document. Now, if you're off-site accessing these reports, you would not be able to view those images straight from there. You would have to go to PACS. You can view the patient's vital signs and the labs as well. So they're here for chest pain. So I want to highlight that troponin and notice that I have a tag option for my labs, just like I did on my documentation once I highlighted it. Objective and physical exam. This is another free text section for us, but I've used the system before and I know that we have some dot phrases available for my physical exam. So I'm going to type .pe complete because I did a full physical exam on this patient. And even though they are having chest pain, they have normal rate and rhythm on that heart. So I'm going to leave it as is. And hit save. Under the problem list, this is where your licensed providers can input the diagnostics or diagnosis for the patient, such as chest pain. They can enter chronic issues such as hypertension here as well. This is also where you would see your nursing problem list. Medications are the medications that are currently ordered for your patient. INO is a pretty simple summary of your INO. If you select one of these drop-down boxes here, you could see a more detailed version if it was broken out into fluids, oral fluids versus IV fluids, urine output versus estimated blood loss for surgery, or different items like that. Under new order entry, you could enter orders directly from here, such as a CBC or a troponin, but we are going to go through orders in a different area as well. So I just want to show you that that is a function that's available to you from the M page. You have your patient's allergies listed, their histories. Again, it'll show you the problem list. This is also, though, where you can see the patient's procedural history, their family history, social, and then if it's a female, their pregnancy history as well. Any outstanding orders or orders that have been placed and not completed. Media gallery, if your patient had any pictures on their chart, for example, of a wound or a burn, it would display here as well. And then finally, our assessment and plan is the patient's plan. So because we're med students, even though we're using what is kind of your standard workflow page, we do not have the med students notes here directly from this page. So once you get to the bottom of your workflow page, you're going to click select other note. And this is going to bring the chart to your dynamic documentation section. And for med students, we have the note type filtered to all because we want to change your note type to, we'll do H&P, and we want to make sure that you have an ability to do the medical student H&P. So we're going to double click that and open it. We have information that pulls directly into your chart from Cerner, such as the medications, patient's past medical history, that social history that would have shown on the other page had it been loading correctly, have their allergies, their code status, and pretty much anything from the right-hand side is stuff that pulls automatically into the chart. The left-hand side of your note are items that you can update and more subjective information that you can fill in. So if you remember us going through that M page, we had already typed in our history of present illness. We had already typed in our review of systems, and we had typed in our physical exam. So one of the things that we had done also while we were in that page was we had tagged some items from other documents. So I want to make sure that this findings from my chest x-ray came in. So I'm actually going to grab it from my left-hand side of tag text, and I'm going to pull it down. Let's let go of it. I'm going to scroll my note down because I want to put it in the diagnostic results section. So I'm going to grab it from my left-hand side tag text, go to my diagnostic results, and then unclick it to drop it. Now, anything that you tag as far as text is going to have this footnote at the end telling you where it came from and who entered the information. As long as you do not edit anything in this finding or in the tag text, that footnote will stay with your note. So let's say for this physical exam, I tagged that and I want to bring it in. But I had done a little bit of my own physical exam as well. So I go in and I edit a portion. Notice that I no longer have a footnote on that physical exam. The last thing that I had tagged was that troponin. So I'm going to pull that into my note as well, under my labs. So this note is called dynamic documentation, and it essentially works as a free text note with different sections that are built to auto pull. Each little section has 3 icons next to it. The first is a refresh. The nice about this refresh button is if you are in there creating your note and then you find out that your patient's labs have resulted or the nurse put in a new set of vital signs, you can hit the refresh button and it would update that information directly in your note. This next one that looks like an enter symbol is to insert a free text field. So where some sections are built to auto pull, not all of them have a free text field. And occasionally you do want to add that free text section to put in whatever you need in your note. The third icon is this X, and it removes a section from your note. So if you had a section that wasn't pertinent, let's say this procedure surgical history wasn't pertinent to your patient, you can hit the X. Now, if you accidentally exited out of a section, you can get it back using the undo button here. So let's say you remove that surgical procedural history, and then you said, well, I don't want to actually remove it from my note. I want to note that the patient has no surgical history. We can undo that. We get our surgical procedural history section back. We'll do an insert free text note and we'll say no history. And then that way we've addressed it as part of our note and not just exited out of it. So just like we use those dot phrases in our in page, we can actually use them within the note here. So I was trying to find a good section to do that, but I'm just going to play and put it in our review of systems section, free text notes. I'm going to add another free text section. And when I do the dot or the period, I can see those same auto text that I saw before. The other auto text that we have in Cerner is a slash phrase. So it's the / that shares a button with the question mark. When I hit that / I get a whole different set of auto text that actually pull in patient-specific information. So this could be their allergies, if we didn't already have that as part of their note. It could be specific cardiac labs or cardiac markers. It could be a CMP only, some medications, RAD results last 3 months, all sorts of patient-specific information. So today, just because I know it works, I'm going to do the /admit date to pull that into my chart. And then it's pulled in my patient's admit date of 5/22/19. So dots and slashes are some really useful things in Cerner that help you to create your note. Another thing that we have as far as auto text is that you can create your own custom auto text. Any note that you're in, you'll see this little button that says Manage Auto Text at the end of your toolbar. When we click that Manage Auto Text, you have a My Phrases tab where you can hit the plus sign, create an abbreviation. I'm going to use the pound key or the hashtag key here, and then enter whatever text you needed. So testing custom auto text or note as a medicine student. I'll save that, exit out, and now when I do my hashtag, I have my test auto text in there as well. So we recommend not to do custom ones as dots or slashes because they get blended in with all the others, even though those auto texts that you create are just for you, so you wouldn't be creating something that somebody else is going to automatically see. It's nice that if you are going to create a lot of your own auto text that you use your own symbols, such as a pound sign, dollar sign, percentage sign. Those are some favorites of people that have created a lot of auto text. All right. Once we've edited our note, if you think that you're going to need to come back and do additional editing, or even some residents, fellows, and attendings, like for med students, simply to save their note instead of sign it, we're going to go ahead and hit save. Save will simply save your note and leave you on your same page. I'll hit OK. If you did save and close, it would save your note, but then close it and take you back to your previous page. So we're going to pretend we hit save and close, and it's going to take us back to our end page. So if I go to this documentation tab in my Cerner menu, I can find my med student H&P, and I know that it's saved and not signed because in the status it says in progress, and it also has big and bold at the top that it's a preliminary report. That means that the note's been saved, but it has not been signed by anyone, including the student. So if you have had to log out of PowerChart and you come back and it's been a long day and you say, oh my gosh, I know that there's a note that I haven't signed yet. Can't remember which one. This is where Message Center for students really comes in handy. Message Center is the inbox where providers will see forwarded notes for sign, they'll see orders for co-sign, and in our ambulatory sites, they do use it for messaging. For you as students, it'll be really useful to see any saved documents. Saved documents are those notes that you have saved and not yet signed. So from the Save Documents tab, I'm going to double click on my note. And then if I knew that I didn't have anything else to do on it, I could simply sign it and OK and close it from here. But I want to go in and be able to edit something. So I'm going to either click the icon that looks like a piece of paper and a pencil right above my banner bar. I can click that to modify, or I can right click on the body of the note and I can select modify. There's that. The only modification I needed to make was that my chief complaint, is that the patient's history of present illness was not ongoing for 2 days. It was actually ongoing for 3 days. Once I've made that edit, I'm ready to send this to my attending for co-signature. So I'm going to hit Sign Submit. And when I select Sign Submit, I'm asked to forward this to a provider before signing. Because as med students, you have to have at least one recipient as a signer before you submit, you will not be able to submit this note without adding a provider. Today I'm going to use my test, KY hospitalist. And if this is a provider I'm going to be with for the month and I'm sending a lot of notes to, I can actually star them so that way they'll be in my favorites and I don't have to search them every time. I can actually even default them as the recipient, and I'll still come to this page, but it'll already be selected for me and I can save myself a couple of clicks. Now, if you have multiple providers that you're sending notes to, you probably want to have a saved list. but you may not want to choose a default. Any provider that's on this list, you'll have to send it to at least to sign. Review and CC will not give that provider an option to sign the note themselves. If you added a provider to this list that you don't need, you can always remove them with this X above the provider's name. Once I've added my test provider, I'll hit submit. And I have now signed my note. When I return to Message Center, I no longer have any saved documents. So I can hit the next button and my Save Documents tab is now closed. The difference between saving a note and signing a note as far as editing, and this is why some providers, attendings prefer you to save it and forward your note versus sign and forward. A saved note can be fully edited within the content. A signed note can only be given a strike through and an addendum. So from my Message Center, I'm going to go to this Recent button to the top right next to my patient search window. And I'm going to go to this down arrow. What's nice about this Recent button is that it shows you the last 5 patient charts that you had open. So you can see some recent patients without having to search for them on your list or through the patient search. So I'm going to open my patient back up. I'm going to click OK. I'm going to go to that Documentation tab. And when I find my med student H&P, I see that's an unauthorized result status because I'm not a licensed personnel yet, so the note still has to be signed by my attending, but it is no longer in progress. Another item that we skipped over previously, but I think it's a good time to talk about it now, is the patient handoff here in the toolbar, or the physician handoff. This is a list that's very useful for the medicine team when they're switching providers during shift, and it allows you to give a quick summary of your patient. So I'm going to acknowledge this blue bar that says I have to select a patient list. On the left-hand side in my list dropdown, I'm going to choose my custom list of Heather's patients and wait for it to open. Now, I would see any patients that are on this list and any information that's in here as well. My patient didn't have any diagnoses listed, so those would not aren't displaying right now, but it would display any diagnoses up front. The useful tool with this physician handoff is via the arrow that's right next to the patient's name, age, and gender. When I select that arrow, it opens my iPass. The first item we see here is the illness severity, so we're going to make this a patient to watch. We can enter a patient summary, such as patient admitted for chest pain, rule out MI. And we'll save that. We can add any action items, which are to-do items. So recheck troponins at 2100. And save. So these are action items that you yourself need to do or that the oncoming provider needs to do. And then finally, we have situational awareness and planning. Now, this is kind of patient-specific events, things that other providers should be aware of with this patient, but this is also very discoverable. So you don't want to say things like patient has very difficult family, because what providers do with this patient handoff is they print it and they use it as a report tool. So if they type patient has very difficult family, leave it sitting on the nurse's station, and said family finds that list, they're probably not going to be happy with us. So we're going to say, we're going to do some planning, and then we're a little situational awareness, politically correct wording. So we're going to say if chest pain increases, recheck EKG and stat troponin. Daughter is highly involved in care and wants to be informed of any changes in patient's status. So we'll save that as well. You do have a second tab here called in your clinical data where you can review the patient's vital signs, labs, medications, and I&O as well from this physician handoff page. We are going to click the X on the right-hand side in the banner bar to close this. And if we had more patients, we would continue moving down the list for these patients. To print this, as I said, many providers like to do, we go to our hamburger button again on the right-hand, kind of top middle of the screen. We have different options here, but the big thing we want to use is this print button. We're going to do a detailed version of this list and hit continue. And this would give us a detailed version of the patient summary, their situational awareness and planning, any action items, allergies, diagnoses, medications, and up here at the top, patient location and name and illness severity. So this would be a list of all those patients that you had in that list displaying on your physician handoff screen. To print this, we go up here to the print button and simply click it and select the printer we want it printed to. We're not going to print this in today's test world, so we are simply going to exit through the door. Another report that providers typically use can be found in this Cerner reporting tool, and there is an option for a physician rounding report that is available to you as well. One of the reasons some providers like this actually to be their page that they open up when they open PowerChart is that going into your patient's chart, you can go into a patient's chart directly from here by clicking on the patient's name. So now that we're in this patient's chart and we're a little more familiar with the chart, let's go through some of these other options on your menu tab. The first one under provider view is your results review. This is where you can see your patient's lab results, recent vitals, some diagnostics, HMPs that were listed, all sorts of different good information for your patient. Under this labs recent and then labs extended, it'll break out just those lab values based on different time ranges. Now that being said, anywhere you see this gray time bar, you can actually right click on it and choose to change your search criteria. So maybe I want to do admission date to current. I can click OK. Notice that my date will change here. Now this is a test patient, so we haven't had any new results recently, but we would have those results listed here if you had more results for a greater time frame. Is also useful if you've had a patient that's been here a long time and maybe you just want to see the past 6 hours because they're getting very frequent lab results or very frequent vitals. If you double click on one of these values, you're going to get a result detail window that'll show you some normal high and low values, what is considered critical. You'll see the action list as well of who ordered it and who performed the draw verification. So notice that this item is orange. High values are going to be orange. Low values will be blue. And any critical items will be considered or will be colored red. Another way to view results here is in one of your other group or list options. It defaults to table. This is right above your timeline. If I go to group, it's going to group the labs out into different lab values. And then if I go to list, it's actually going to list the values. And the reason I like this here too for a training purpose is because it gives you the reference ranges directly on this list without having to double click each value. So if you're unfamiliar with certain lab results, you can do this list view and have a quick view of your ranges. So we have a high troponin, but how high is it? The next tab here is this radiology. It is also a tab on your results review. And what that does is allow quick access to radiology reports. And if you double click on that result, it'll pull up your result report that we saw previously in the M page. We talked about documentation tab. This, if you didn't notice yet, it just basically shows you a list of all the documents available. We are choosing to display all, but you could filter out to only physician notes. And if you do that, it will remove your med student H&P. But if you filter back to all, you'll see more detailed documents available to you. Another way to view documentation is through this Documents and Reports tab. This is more of a folder view, so you can choose to start double clicking through these different folders to find what you're looking for, or you can use the arrow down here in the bottom to actually just keep going down, down, down through the folders. The reason I like this view is because you have different filtering options, not just by the type of documentation you have, but also by the status, the date, who it was performed by. So if you knew that Dr. Smith had written a note on this patient and you wanted to see specifically what Dr. Smith's H&P was for this patient, you could go specifically to who it was performed by. And then you can also do by encounter. So those frequent flyer patients, or maybe they were just here a month ago and you wanted to see, well, what was their admission when they came in, and compare it to baseline, you could quickly look that up. The MAR and MAR summary are two different ways to look at your patient's medications. I really like the MAR summary for providers simply because it is a more condensed view. It shows a day within a few columns versus the MAR marches it out more frequently, and so can be a little harder to read at times. I&O, this is where nursing will do their documentation. So when I&O initially opens, you first just may see an intake and output, or only one or a few navigator bands is what these different sections are called. If I come up here to view, layout, and navigator bands, I'll see a screen somewhat similar to my patient list view, where I have available documentation on my left-hand side and current documentation on my right-hand side. The current documentation types are the documentation types that I see, whereas available documents is everything available in the system. So maybe I want to see some more information on lines and drains. I want to see some scales and screens. I want to do the blood administration. I can add all those different bands, navigator bands, over to my current document types, and then I'll click OK. Now I'm going to get this alert that says I need to restart the application in order to see these bands, but you actually don't need to restart the whole application. I simply click out of my patient's chart, go back to my recents, open it back up, and when I go back to iView I&O, I'll see those additional documentation bands available for me to view some more information. Note again, you have this time column at the top that you can right-click and edit what information you're seeing. So the final thing that we're going to go through here, there's a lot more items on this menu tab, but a lot of them we've touched on actually within that M page. These are just different ways to get to those items. So diagnoses and problems, histories, allergies, calculators. These are all different ways to get to the same things that we've already seen. Patient information is really nice because you have the visit list, so all those patient visit lists. but also this PPR summary. And PPR summary is patient-provider relationship summary. So anytime someone's gone into a patient's chart, it adds a relationship to the chart, and it keeps it there for tracking and for auditing purposes. So just so you know, it is very face up any charts that you are in. So I want to talk about orders really quick before we wrap up. As med students, you will not be able to fully place orders, but you will be able to propose orders to your upper level providers if they are allowing you to. So when you're in this order screen, your display is going to tell you what you see. Right now I'm seeing all orders, all statuses. So that means anything that's been ordered, completed, discontinued, what have you, is going to be future, are all going to be displayed there. If that's too much because your patient's been here a long time or they've had a lot going on, you may want to change that display and see simply all active orders. Now for this patient, that's not going to change my view. That is an option for you. To add an order, we click the Add button. And then we can start searching. For example, we are allowed to put in the activity order of rest for this patient. So I'm going to start typing in my search, and I'd hit my Enter button on my keyboard. And I'm going to select bed rest. In this system, as a med student, we do not have an order option. It is simply a proposal. And I'm going to propose this to my attending test, KY cardiologist. If the name doesn't initially pop up in this physician name, I'll hit my magnifying glass. I find my cardiologist in the list and hit OK. The other thing that our provider has said that we can order is a BMP on this patient. So I'm going to search BMP. When I first do that search, I have my short drop down and I can hit enter to give me all the orders that'll have BMP in the title or in the order. And any orders that have the little gray afterwards, those are what we call order sentences. And they are basically information that's pre-filled out for your order. So I want this BMP to be a stat collect. And I'm going to click done. If I had not selected stat, maybe I remove my collection priority from that. It won't let me. If I had some sort of missing required detail in here, I would see a blue circle with a white X. So let me get an order for you that we're going to have that. We'll add a CMP, CBC on. We don't need any differential. Let's say I choose one of these non-order sentence orders. I'm still going to say none and hit OK. And once I'm done adding orders, I will hit the done button again. And now I have this blue circle with the white X here. That means I have missing required details in my order. So I'm choosing to add this CBC on to some blood that's in the lab. Any orders that are placed by a student are going to go as proposed. So they're going to be labeled with this blue circle, white question mark as a new order proposal until it's been signed by an upper level provider. Once I've entered all of my orders in, I'll simply hit sign and refresh. So this refresh button is one we haven't talked about yet. There are certain areas in the chart that'll automatically refresh for you. But there are other areas such as your order screen, your patient list, your documentation list that will not auto refresh. The reason for that is the system doesn't want to kick you out mid putting in orders, putting in some documentation. So you do have to manually refresh in order to see the most accurate information in your chart. Now, if you log out and log back in, of course, it's going to show you the most up-to-date information. But just be aware that sometimes you need to refresh your screen to see what's most up to date. We see our bed rest order here is listed as a proposal. These orders will be visible on the chart for nursing and other staff members, but it'll display here like this as a proposal with a blue circle and the white question mark. If you are on a rotation where you're able to put in a lot of orders and you find yourself ordering the same thing over and over again, you can create favorites. So you click add, you search for your order. So let's say you're in charge of putting in the patient's routine weight order. Find the order that you want to do, click on it to add it to your scratch pad. We'll hit done. And then once this order's on your scratch pad and you filled out your required details, we'll right click on it and we'll add it to favorites. So you could choose to do a favorites folder such as daily orders, or you could just do it in your general favorites folder. I don't want to actually order this on this patient right now, so I'm going to refresh to cancel my order out. I'm going to hit the add button. And when I go to my favorites tab, I have this new folder here, and I have that weight routine that I don't have to type into search. I can simply click it. My details are listed in, and I'm going to sign. That's how to do order favorites. The other thing you need to do when you go into PowerChart on your own profile, under documentation, you'll have to set up your favorites there as well. So when we click the add button and we see all of these templates, you have two medical student templates here. And if I type in the search, medical, I can put stars. I could do that without the search. I just think it's nice to single out those two templates so that way I don't get click happy. And add those two med student templates to my favorites tab. And then next time I go to add a new note, I have two favorites that I can choose from instead of looking at the 70 other templates and trying to search for them every time. So I can go straight into my med student notes. I can open it up and begin my charting if I'm not going through the M page. I'm going to cancel this out and discard my changes. I've done everything I need to do with my patients today. And I'm finished with my shift, finished with our training. So we're going to go ahead and exit through the door. And thank you for joining us. Have a good rest of your day.